Welcome to Plastic Surgery Secrets Talk, the podcast where we go behind the scenes of everything interesting in plastic surgery and the aesthetics world. I'm Dr. Jeffrey Spiegel.
I'm Dr. Tower.
And I'm Dr. O'Neill from the Spiegel Center just outside of Boston. We are excited for season 3 to continue.
So let's start with one of the most memorable parts of our jobs, those unique and sometimes outrageous requests we get from patients. Each year there's something that makes us pause and go, wait, what do you want? Also, for this particular podcast, we're trying a different format where they're putting me into an isolation booth, and I won't be able to hear what Dr. Tower and Dr. O'Neill says until I listen to the podcast afterwards, so I'm super interested to hear what they say. But for me, let's start with a couple different things. I think in 2024, the theme that made me go, wait, what, was when people wanted to change things that you couldn't see. Right. Wait, what? So I had a few people this year who had things about their body that they couldn't see. They were normal, and they couldn't see it, such as, oh, I feel like a certain part of the back of my head or back of my shoulder or something feels a little flat or feels a little different. And it looked fine. We're not talking about significant changes here. We're talking about areas that essentially are basically normal. And then I need to go, but you can't see it. You only know it's there if you go feel it. So why do you want to change it? And I have to make the important distinction as to, am I going to help this person or not help this person if I indeed take on the challenge? So let's take it as an example, someone who has the sensation or the belief that the back of their head's a little bit flat. Now, this can happen, right? It can be just the way your skull grew, and pediatricians will tell us that you want to rotate babies in the crib so they don't get a flat back of their head, which can occur. But most of the time, your hair grows over that area. So even if it is a little bit flat, it sits and looks pretty much fine. Now, you might feel it as maybe it reminds you of something that you don't like, and that could be the issue. In those cases, we actually can change it. How would you round the back of someone's head? You could do it with graft material like fat or filler, or we could put in a custom-made implant. You can get a CAT scan done and then develop a very custom implant to change the shape of the area exactly as you want, and then that can be slid into the proper place. Now, these are not things that are commonly done, and for those of you who know me, I don't typically think that CAT scans are indicated for most surgery that's done in the aesthetic world, because as long as you know what you're doing, you don't need it. But that would be an indication for one for sure. And that's the kind of thing that we saw in 2024 a couple of times. And in some cases, I think I did the right thing by explaining to the person that it's just not worth doing that. That what you have is actually normal and looks fine. That's a very important part of our job. We're not here as technicians exclusively. We're here to help you achieve a goal. And most of the time that goal is feeling happy and comfortable with who you are. So sometimes the best way to do that is to help you be happy and comfortable with what you have. And other times it's to say, yeah, it's not that hard to get you what you want to see and feel. Okay, so Dr. Tower, off in your secret booth. Let's hear what you have to say. What's your pick for your most interesting request of 2024?
I've gotten a few interesting requests this year that all kind of fall into the same theme, and I think that's why they stick out to me a little bit. So I guess the first one I'll say was a patient who had seen me because she was interested in revision rhinoplasty. And when we dug into the details of her original surgery, it turned out it had taken place in a foreign country. And the process was she had taken pictures of herself, I presume from different angles, and sent them to her surgeon in this foreign country. And basically, that surgeon, probably not even the surgeon himself, but maybe somebody on the team there, then morphed the photos or basically photoshopped them to show her, yeah, this is what we could anticipate your nose will look like after surgery. So then based on that assessment, she decided to proceed, travel to a foreign country where I guess they have sort of a all-in-one package that includes your hotel stay, your hospital fees, etc. and she met her surgeon for the very first time in the pre-op area immediately before surgery, and had very little time to engage and discuss sort of what could be expected in terms of the whole surgical process. And then when all is said and done, when she had the reveal, she knew immediately that the result, the outcome, wasn't what she had signed up for, but traveled back to the United States, and within a year afterward, I think it was only a few months, 3 to 6 months afterward, had found her way to my office to talk about revising that work. There's kind of a lot of alarming things about this, but I think the big takeaway is that when you have your surgery done in a foreign country, you don't really necessarily have the opportunity to meet with your surgeon, to really meet with them face to face so they can analyze how your nose looks in 3D. I tell people all the time that your nose doesn't exist in 2 dimensions. It's a 3-dimensional object, and that although anyone can make a nose look however they want on Photoshop, just because you can do that, you might have good Photoshop skills, doesn't mean you have good surgical skills, and that you can actually deliver the results that you're showing people. So you have to be very cautious in terms of what you believe. If a surgeon can show their before, after, and their morphed photo time and time again and how close they came to those results, that's amazing. But you've got to be very careful in terms of selecting a surgeon based on promises they might make. The other sort of interesting requests that I got were along the same lines, patients who had especially rhinoplasties done in foreign countries. And then they realized that even though the surgery is done, the healing process isn't done by the time they return home. And sometimes little things are done along the way to help you optimize your result. And one of those things could be steroid injections. So I've had a number of patients who've had surgeries done elsewhere. They come here requesting steroid injections because their surgeon told them, oh, your nose isn't exactly what you'd wanted. Go find a surgeon who will inject it with steroids because you're not going to be flying back here for that. And so then it's left in our lap to decide what to do. If it's my own patient and I've done rhinoplasty and I think steroids are the right thing to do, that's one thing. But when someone else has done the surgery, I don't know exactly what's going on underneath the skin. It's harder for me to anticipate exactly what steroids are going to do for them, and whether it's the right thing to do or not. I also have sort of exact time frames of when I would typically inject steroids if it's going to be done. So if a patient shows up way too soon or way too late for those kinds of things, just based on somebody's advice from thousands of miles away, it's not too helpful to us, and it can put us in a tricky situation. And so those are interesting challenges now that we're facing in sort of this global surgery, plastic surgery environment we live in, because people can travel anywhere these days. But sometimes the before care and after care can become quite complicated if you don't have good access to your surgeon. So having said all of that, I'm sure Dr. O'Neill has some interesting patient stories she'd like to share. So Dr. O'Neill, what would you like to tell us?
What was the most interesting thing this past year? Well, actually, I have this one patient, but she only does tight and bright to her neck. And I find that interesting. Now, yes, her face looks amazing, and many people do the tight and bright to their face and not to their neck. So there's a little bit of a disconnect between the face and the neck. So you certainly want to treat the face. I always say it starts right up here where your hairline ends, and it ends right here where your breasts start at the end of your décolleté. So the face needs to be treated all the way from up here to down here where your décolleté ends. So if you're doing tight and bright, if you're doing just Morpheus or IPL, I would recommend doing it from the top of your head all the way to your décolleté. And obviously, budgeting is part of making decisions in life, and if you need to budget, then I would definitely start with the face, then go to the neck, and then the décolleté. And also, some people are just they don't expose their décolleté a lot, especially if you live around here where it's a little bit colder, so you've got all those months where you're not exposed to the sun. So your face obviously is going to see the sun a lot more than your neck or your décolleté. So that's where I usually start, with a tight and bright, or just the IPL, or just the Morpheus, really just the face. So when someone comes and says, no, I only want the IPL, or I only want the Morpheus, or I only want both of them only to the neck or only to the décolleté. It's a little odd.
One of the most significant parts of my job is that I get to build deep relationships with the people who come to see me. People will often open up and share stories that they don't share with other people because they feel safe, they feel heard, they feel that I'm here to help them, and indeed I am. As I always say, there's no value in what I do unless the person who came to see me feels like they got what they wanted. But there are times, of course, where people will surprise us with confessions that we just didn't expect. For me, this often involves, maybe it's dishonesty, maybe it's carefully withholding information that you're afraid to admit. But there are times where people will come to see us and say, no, I've never had surgery before. And I'll look at them and go, but you have a scar of the surgery right there. I can see it. And they'll say, no, I've never had surgery. And I'll say, but I can practically see the implant. No, I've never had surgery. It's never been the case at all. And then that makes me wonder, right? Arsenio Hall, a long time ago, used to call this the things that make you go, phenomenon. And indeed, that's it, because you go, well, what does this mean? Are you not aware you had surgery? Did someone tell you something else? Once in a while, that's it. We've had people who didn't know they had surgery as a child, people who feel like their ears stick out a little bit too much. And they'll come in and say, I'd like my ears brought in, and I'll look behind their ear, and there's a scar of a previous ear surgery. So I'll say, hey, when did you have the previous ear surgery? And they'll go, I never had ear surgery before. And their mother just didn't tell them that when they were 5 years old they had ear surgery, or they just didn't remember it. They've forgotten after all these years. And their mother's like, you forgot? Great. Now we don't need to talk about it, because that can happen. But other times it's on things where someone might say, I'd like my chin shaped differently. I'll say, have you ever had surgery on your chin before? No, okay. No. And then when we get to surgery and we're looking in a spot that we otherwise wouldn't have been looking, I'll see a faint mark of surgery from long ago. Other times we'll actually go in on the chin and find a chin implant there. Like, well, you knew you had that one. I think the reason not to admit it is because they feel like, it'll be less pricey if I don't tell them that it's a revision surgery or this or that. But most of the time, that's not really a good decision, because the more we know, the better we can plan. We can adapt to anything, and we always make sure we get the right outcome, but honesty is the best policy. Dr. Tower, tell us about a secret confession you received from a patient this year.
All right, so surprising confessions. Patients tell us things all the time that they probably don't share with even like close friends and family. So I do feel that we often, they're very trusting with us. But occasionally they'll confess things that happen at some part before, during, or after their surgical process that can be surprising. So what surprised me, this is quite recently, so this is one sort of on the that comes to mind, is I had met a patient a couple of years ago, actually, and I had done a facelift for her. She loved the results. She's somebody who, part of the reason she had a facelift, neck lift done, was she had lost so much weight that had caused a lot of skin laxity, not just in her face and neck, but her whole body. So she had also had plastic surgery done out of state, and I think at some point along the road, maybe in another country. And that included, I believe, tummy tuck surgery, so abdominoplasty, brachioplasty, arm lift, leg lifts to remove all that extra skin. When those types of surgeries are done, long incisions are made, usually in places that are reasonably well concealed to hide it. And unfortunately, she wasn't happy with those results. She had wound up with these big hypertrophic scars that basically look stretched and kind of bumpy and lumpy and firm. And so because we had such a great experience with her facelift, she trusted me to do her scar revisions on some of these body parts, basically arms and legs. And she came in a few times to do these scar revisions. I checked in with her periodically afterwards. So those are like either in-person or telehealth visits. And one thing that we do, especially with revision scars, is I'll have them use adhesive silicone. Really am careful to counsel patients on how to get the best optimal results. because sometimes it's not just surgical technique, what I do, it's also how you care for these things afterward. So we'd done this stuff, and I think about 6 months had gone by, and our lives get busy again. And then the next time I heard from her was probably close to a year after these scar revisions, and unfortunately, she confessed to me that the scars had returned, and the results weren't as good as she had hoped. And in probing why this might have happened, the real confession was that she had stopped using the adhesive silicone strips that she was supposed to be using. She had resumed a lot of activities like dancing, performing, athletic endeavors that put a lot of stress and strain on these parts of the skin where they're trying to heal. And when skin gets stressed and strained and pulled while it's trying to heal under tension, that's what tends to make scars reappear as hypertrophic, with stretched and lumpy appearances. So to her credit, she immediately said, I know that this could have been, at least in part, like due to my fault and what I've done here. And so it's basically something that we got to work on again now. And having taken those lessons, to revise some aspects of these scars again. But I do appreciate it when patients come to me and tell me, maybe this thing wasn't quite perfect, and what can we do to make it better, rather than either giving up or going elsewhere, or whatever the case may be. And so I'm always happy to take care of my patients. And so, Dr. O'Neill, I bet you also have some interesting patient confessions to tell us.
So the most surprising result was actually from a patient who I've seen for, over a dozen years. She came here in her mid-30s, and she said, I was starting to see some sagginess, and maybe I need the mini facelift or the micro facelift, that kind of thing. And Dr. Spiegel was like, oh, I don't think you're ready for it. Let's just do a little bit filler or Botox. And that was a dozen years ago, quite a long time ago. She was actually one of my first patients. She now knows it. She didn't know it at the time. So so we started with Botox and fillers, and she's been coming to me, for about 10 to 12 years. And she actually gave me the nicest story she had to tell me just on her last visit. It was right around her birthday, and she said, I went to the airport, and this is someone who goes to the airport a lot because she used to be a flight attendant, and she went to the airport, and she got a lot of questioning, where do you live, and how long have you lived here, and what's your age, and when's your birthday. So she's used to questioning at the airport, and she said, wait, this is odd, why all this questioning? And the person there just said, I just don't believe that you are this person that you just gave me an ID for, because you look way younger. And she goes, oh my God, I got to tell Dr. O'Neill about that. So we're used to hearing those kind of stories when people go to the airport after they've had a facelift or that kind of thing, where sometimes it doesn't even recognize them, their ID, and their face. When they go for that photo, there's disconnect there. But I've never had that with a patient who's never had surgery. So that's kind of cool.
Rounding out the podcast for this January of 2025, every year there are cases that test us. Not just our skills, but our ability to think creatively, to problem solve, to connect with our patients. The ones where you really go, I'm awake. I'm on full alert here. Something's not right. Something is not automatic pilot here. Challenging cases are ones that do stick out in our memories. The one that comes to mind is somebody had surgery on their skull overseas in a foreign country. I won't say where. And they came to me to get it addressed. Now, they couldn't get the records from this other country. They weren't allowed back there. It was done before there were electronic charts. It was not something that we had access to. But we took a look, and we just said, okay, I know what you want. I think we can do this. And we went ahead, and when I got to this person's skull, it was covered in some sort of implant. Now, I've seen every kind of implant there is that I've ever heard of in the last 27, 30 years of working. But this was something I've never seen before, Maybe it's like when a geologist comes across an asteroid chunk out in the field, and they're looking at this going, whoa, this is different. And that's what it was. It was porous like a sponge. It had areas of holes, almost like really aerated concrete. It was crumbly. It was multicolored. I had no idea what this was. It looked like something that could have been seriously infected in the past and then resolved, but usually those kinds of infections don't get better. So whatever they had put into this person, we cleared it up. We found the native bone. We fixed it. That was a nice little surprise. That was a certain challenge. And then other types of challenges that we encounter are ones which really relate to manners and decorum, I'd say. Every now and then I'll see someone who comes in and says, I just had surgery on my brows or face or chin or cheeks or forehead or something. I just had it done a month ago, and I'm here to talk about something else. Now I'll look at them, and it's clear that whoever did the other surgeries missed it. They just didn't do it right. They didn't do it enough. They didn't get the person what the person needed or paid for or deserved. And then I'm in a tricky situation. Do I say, okay, good, let's talk about your nose, or do I owe it to them to bring up that I think the last surgery they had wasn't so good? And the way I've come to address this is I'll usually say to someone, you've had your forehead done. Tell me, how do you feel about it? If they say, I'm not happy, shoosh, then I can address why that's a reasonable feeling. If they say, I am happy, I love it, then you say, okay, there are different tastes. Maybe this is what you're looking for, even though, in my opinion, this is not a great outcome. But the worst ones or the toughest ones are when they say, well, what do you think about it? And that's when I just go, oh, you put it right back on me, huh? All right, I'm just going for it. And I'll say, hey, listen, I think we could have done better. I think you could get a bigger change, a more significant change. But if you're happy, you don't have to do anything. And sometimes when I do that, the person shows obvious relief, like, oh, thank goodness you said that. It wasn't just me. I was really hoping you'd bring that up. Yes, let's fix that, please. And that's a situation where it's a little awkward to get to the right spot, but ultimately getting the person the right result is what we're looking for. So, Dr. Jacob Tower, what's one thing that really pushed you this year in 2024?
Okay, so challenging cases. I mean, every case is a challenging case in one way or another. It's challenging because even things that could be the most simplistic thing that we do, like a mole removal or an earlobe repair or whatever the case may be, we always want to make sure that the result is the best possible result that you can get. So even the simplest things, I put the most care and attention into. But some things are just inherently more demanding, more challenging than others, and there can be reasons for that. Number one could be complexity. Number two could be duration. So like as a surgeon, I kind of look at myself as an athlete sometimes, and sometimes it's like an endurance athlete. And so I have two cases that come to mind that were particularly challenging in 2024. The first is a revision rhinoplasty, but not just any revision. It was a patient who had already had 4 previous rhinoplasties. And it's kind of like the fish. Like every time I tell this story, the fish that I caught gets bigger every time. And maybe every time I tell this story, it's like next time it'll be she had 5 prior rhinoplasties or 6 prior rhinoplasties, but it was 4 prior rhinoplasties. And because her nose had been operated on so many times, it was sort of unfortunately the stereotypical case of too much plastic surgery that had caused the nose to become very small and collapsed in the tip, basically entirely made out of scar tissue. Her septum, which is the dividing wall between the two sides of the nose, was perforated with a hole in it about the size of a nickel, so like 2 centimeters wide, which causes a lot of problems with airflow. So it causes turbulent airflow, problems with breathing, crusting on the inside of the nose, chronic bleeding, just discomfort overall. And from the outside, it had a saddle nose deformity, meaning the bridge of her nose had collapsed, causing a really unnatural and kind of unappealing appearance to it. So all of these things were problematic to her. And, this is a case where we really have to think twice about whether we should operate at all. But I felt confident I could do the job for her, and we ended up reconstructing her nose using fascia from the temple, which is some connective tissue that lives underneath the skin. We also used rib cartilage to rebuild the bridge in the nose and reconstruct it, build it back stronger, and with a much more natural shape than it had before. And the most challenging thing of all is managing the skin, because every time you do a rhinoplasty and you're lifting the skin up, you're inevitably weakening its blood supply. And poor blood supply sometimes means poor healing. So we're very lucky that we have our own hyperbaric oxygen chamber here so that we could actually go on many dives. It's basically where we're in a pressurized chamber supplying an oxygen-rich environment to help with healing after surgery. And I'm glad we did. We had early on a little bit of skin discoloration and kind of tenuous healing in parts of the nose, but it all turned out really great. She was thrilled with the results, but definitely a challenging rhinoplasty. That's about as difficult as it gets to reconstruct it inside and out and get a great cosmetic and functional result. Those are my challenging cases, and I'm going to pass it over to Dr. O'Neill to see what she's got from this year.
So what's the most challenging this year? That's always a good question. For me, traditionally, it's been talking about the temples. I always say to patients, fill the temples, and then everything kind of comes up, because people come in and they complain about their static lines between the nose and the mouth. That's the nasolabial folds or the marionette lines. And I always say to them, let's not fill that, because if you just fill that, it's going to just get your face very puffy. But if you fill it in the temples, it kind of raises everything. You can kind of play in front of the mirror and do it yourself in front of the mirror, and you'll see that if you lift a little bit by the temples, the nasolabial folds and the marionette lines kind of disappear. Don't want to do it from the cheeks, because most women, 99.99999% of us, have really nice zygomatic arches. So you don't need a lot of filler in your cheeks. You need it all in the temples. And that corrects for the nasolabial and the marionette lines. So that has traditionally been the most challenging thing for me to kind of educate my patients and get them to do. But I think we do so much Instagram and we do this podcast and we do so much education that I think at this point I've had some not fillers, but I've had some patients come in and say, I need the temple fillers done. And I'm always shocked by it. What do you mean? You are coming to me to ask for the temple fillers? I always had to convince you to do it. So that's kind of nice to see that going away and being able to do the temples without a lot of education, because I've already done it on my podcast and I've already done it on my Instagram and Facebook and all of that. But it seems like now people are coming in and they're saying, I need an upper blepharoplasty. My eyes are sinking into the back. And I think it's challenging to tell people that you can actually undo that, and maybe an upper blepharoplasty is not the answer, but actually upper eyelid fillers. So that has to be the most challenging for 2024.
So thank you for joining us on our trip down memory lane as we reflected upon some unusual situations of 2024. We've loved sharing our experiences with you, and we're looking forward to all that the new year has in store. Whether you're a prospective patient, a past patient, a fellow doctor, a colleague, or just someone curious about what we do, we appreciate you being here. Send us your feedback, send us your questions. We love to interact. And until next time, take care, and may 2025 bring you all the best.